Hi, I'm Laura, and we're here at Dr. Kanaga's office meeting with one of his associates, Dr. Yu. Welcome, Dr. Yu.
Thank you.
How are you doing today?
Good.
Very good. So how long have you been working with Dr. Kanaga?
I've been working with Dr. Kanaga for about a year now.
And then how long have you been a dentist?
I've been a dentist for 2 years.
Very good. So do you do general dentistry or do you have a specialty?
I'm a general dentist.
And is there any particular age range that you specialize in?
No, I see all ages, actually. I see kids and adults as well.
And then is there a minimum age that you would recommend for children to come in?
Actually, the minimum age is when the child actually receives his or her first tooth.
Oh, first tooth. Okay. So how do you get the children to sit still in the chair while you're
I use the tell, show, do method, which basically I first tell them what I'm going to do, afterwards show them what I'm going to do, and then do actually the procedure.
And you find that works pretty well?
Usually, yes.
So what is it that you enjoy about working with children?
I enjoy teaching them about oral hygiene and improving their oral hygiene.
And having a positive influence on them when
Exactly,
they're young,
yeah.
Not the scary dentist.
Exactly.
Do you have any activities outside the office that you enjoy doing?
Yeah, I actually volunteer at the Samaritan House in Redwood City in San Mateo, where we serve the underserved population of the peninsula.
Okay. And then is that mainly children as well? Or is that all
Actually,
ages?
it's all ages, children and adults. We actually do all different procedures from oral hygiene all the way to oral health education and crowns and bridges.
Is there common problems you find among that population?
Yes, actually, the population that we mostly deal with is the Hispanic population. So a lot of the population actually are diabetic.
Okay. And does that cause problems with the gums?
Periodontally, it does. Diabetes actually really influences the periodontal condition of the mouth.
Very good. And then do you have a lot of cases like that here as well, or do you tend to find just more cleaning?
The Asian population also seems to have a large periodontal problem. I think it's due to the fact that culturally, perhaps oral hygiene education wasn't stressed as much. So patients don't floss as often as I would like them to, but definitely here we provide the oral health education that they need.
So if you could recommend oral health care to your patient, what do you ask them to try to do on a daily basis?
I tell them to at least brush 2 times per day and to floss at least 1 time per day.
So being a dentist is more physically demanding than most people think. How do you stay in shape physically?
I recently just did the San Jose Rock and Roll Half Marathon.
Wow. So what's different about Dr. Kanaga's practice?
Dr. Kanaga's practice actually offers many resources that we can refer to, such as Dr. Fuller, who's our in-house periodontist, and as well Dr. Kanaga also offers continuing education classes for us that allows us to be updated on the newest and latest techniques.
Very nice. And then do you do a lot of the procedures here in the office, or do you have to do those elsewhere?
Actually, we provide most procedures in the office, anywhere from crowns and bridges to root canals to implants.